The skeletal system is also made up of more than 300 joints that are connected by ligaments. These ligaments bind bone to bone and are made of, you guessed it, tough, fibrous connective tissue. Again, there is no blood flow to ligaments, so injuring them requires lots of time and rest to help them recover. Joints are enclosed by a protective outer covering of connective tissue called the joint capsule. It's filled with a slippery substance called synovial fluid. For our purposes, we are going to look closely at two different types of joints in the body. The first one we are going to look at is a hinge joint. This happens in our elbows and knees. This is where the bumpy surface of one bone fits into the concave surface of another. Usually there's only one direction or one plane of movement, but because of the placement of the ACL and the PCL, the knee is able to give a slight rotation. The ligaments are named because of their placement in the body. If you remember from earlier, the anterior cruciate ligament is closer to the front of the knee, and the posterior cruciate ligament is closer to the back. Again, the medial collateral ligament is located on the medial side of the body, and the lateral collateral ligament is located more towards the outside of the body. The second joint we'll be discussing is the ball and socket joint found in the hips and shoulders. This is where the head of one bone fits up into the cavity of another and is held there with ligaments and a joint capsule filled with synovial fluid. There are also sacs of this fluid surrounding the joints called bursa. These can become inflamed and tender if the joint is not properly cared for. This type of joint gives the widest range of movement. It can also cause the most problems as there are so many ligaments and muscles that are needed to hold it in place.